It's a very safe medicine. I'll say that, and the rates of injuries, accidents, and side effects are very, very low. Can it treat everything? No, but it's for non-urgent or non life-threatening conditions, it's probably a good alternative to start with and see where it takes you.
What were your dreams when you were a kid? What did you want to be when you grew up?
Oh gosh. I don't think I really thought about a profession all that clearly. Um, that's a good one. Yeah, quite frankly, I kind of stumbled and fumbled around a little bit. I was a history major as an undergrad, and that was very interesting. And I learned how to write and think and so on, but it didn't really lead in a clear vocational path. It was I quite literally stumbled into acupuncture through a soccer injury where I injured my right leg, and I was living in San Francisco at the time, and conventional physical therapy didn't really seem to do that much for me. Um, and what helped me rehabilitate it was a fairly severe injury. I was kind of limping around for several years in chronic pain and started getting some sciatica and back problems because my gait was off and everything. And it's Tai Chi practice, the slow moving Chinese martial art dance form that really helped rehabilitate my injured leg. And that's what kind of got me interested in. And it was very easy in San Francisco to explore Chinese herb shops and acupuncture clinics. So after doing Tai Chi and getting acupuncture for several years, I decided I wanted to investigate that as a profession for myself. I'd been working as a community organizer, and I liked that a lot too. But it was there was something missing for me there that I found through going to deeper into acupuncture and Chinese medicine. So
Yeah. So it was Tai Chi, you said, that helped heal your ankle?
Yeah. I tore my groin muscles in my right leg. I was kicking for a soccer ball, missed the ball, kicked the ground, and the ground didn't go anywhere. So something had to give way. And I tore all the adductors in my right leg and fell over, and couldn't walk for a while and stuff. And yeah, Tai Chi really helped a lot. It's for those of you that aren't familiar with it, it's kind of it can be done as a martial art, but it's also done as a sort of a health maintenance exercise, often for older people. It's really good it's very slow moving, kind of graceful, shifting weight from one leg to another and kind of balance and coordination. And it really kind of rewired my nervous system to be able to trust my right leg again and stand on it and use it effectively. So that's how I got interested. Yeah.
Yeah. So that's commonly used as a rehabilitative sort of practice?
Not in this country. In China, yeah. It by itself, it's not really it's not kind of a standalone treatment for chronic pain or acute injuries. For me, it was kind of a gateway into a bigger world. It definitely helped a lot, but I didn't really discover it until a couple years after the soccer injury, and by that time, the acute inflammation and tissue damage had healed, but I had a lot of scar tissue in my leg, and I had a lot of my nervous system was not was not trusting that leg anymore, was not using it effectively, so I was kind of limping and you know hesitant to put full weight on it and so on. And that's what Tai Chi allowed me to do, is very carefully, in a slow guided way, start shifting my weight back on my right leg and trusting it and using it properly. Now I don't even hardly think about it. I mean, there's some residual imbalance that probably will always be with me, but it's like 95% better. So
Yeah. And so getting into acupuncture was just a environmental thing for you? There was just lots of it in the area, or was there something specific that kind of sparked your interest?
Well, I think it was, it was the combination of having felt like the physical therapy that I was prescribed didn't really do that much for me, and then finding that the Tai Chi really worked for me, and it just kind of sparked my interest in, like, because in San Francisco, where the large Chinese community, there's Tai Chi classes in the parks, and there's acupuncture clinics and herb shops, and I started reading up a little bit on it. It's like, oh, this is part of a larger system of holistic healthcare that I have easy access to living here in San Francisco. I also developed, unrelated to the soccer injury, a few years later, I developed a condition called irritable bowel syndrome, where I was just having a lot of trouble digesting food, and a lot of abdominal pain after eating and so on. And that too responded to acupuncture and Chinese herbs, where the Western doc just basically screened me to make sure I didn't have a tumor, and then said, "Oh, reduce your stress level and eat more fiber." And I'm like, "Well, I eat a high fiber diet as it is, and how exactly am I supposed to reduce my stress level?" And it just didn't lead anywhere. Whereas I found the acupuncture and the herbs helped with the irritable bowel syndrome too. I'm like, okay, here's another condition that's responding well to the classical Chinese approach, the very holistic approach, and that isn't where I'm not getting anything from conventional Western medicine. So that was kind of the next thing that, it's like, after doing this for a while, like I want to learn more about this, and I want to help other people, benefit from what I've learned. So that's how I got into it. So.
Yeah. And so you made your decision. How did you make the decision specifically that you wanted to pursue acupuncture as a career? Was it just you wanted to help other people do that?
Yeah, it was a combination of personal interest because it had worked well for me, and then feeling like, having benefited from it and having learned a lot in the process of, dealing with my own injuries and illnesses, that it was something I wanted to share with others. I always had kind of a service orientation. I wasn't interested in so much like, making money or, running a big business or, the work that I also enjoyed as a community organizer was also very unstable. It was always like grant and donation funded. And when grants run out, you're out of a job and stuff. And I'm like, I need a more stable, even though it was very rewarding working. I worked with very diverse, low income communities in the city of San Francisco, part of a team, hiring homeless people to fix up housing, and that they got to live in the housing and get the jobs and so on. It was great for society, but it was, after 10 years, it was like, I can't keep doing this. And, I'm going to wind up homeless myself if I don't, if I don't have a stable income and a real profession, because I was kind of patching together skill sets without any formal training or degree or, role in the community and stuff. And so, so it was a big shift to what in some ways was a completely different line of, service, one-on-one care for individuals using medicine rather than community organizing. But there's this kind of the same basic motivation for me of like, do what I can to help my fellow human beings, So.
Yeah. Yeah. And so you go on to pursue an education. Where did you go to school?
So in California, at the time there was a dozen or so degree granting schools of acupuncture and traditional Chinese medicine, and I started at one, ended up transferring to another, and at the time the degree was a master's degree. Now it's a doctorate degree that you have to complete in order to get licensed to practice in most states. And I graduated from a school called the Five Branches University of Traditional Chinese Medicine in Santa Cruz, California, which is actually the town I grew up in. But as a kid, I had no idea that there was this school of Chinese medicine there. It was, so it was a strange experience of coming back home to a strange place I'd never been in my hometown, and getting a whole other degree, a master's degree in traditional Chinese medicine, and then getting licensed to practice. So.
Yeah. And so your degree is holistically in Chinese medicine entirely, not just in acupuncture.
Yeah. So the five branches refers to the five classical branches of Chinese medicine, which are acupuncture and herbology, are the sort of two main ones that are the best known, but also Tai Chi and its kind of cousin Qigong, which is Qigong is like the building blocks of Tai Chi. It's like small movements and targeting specific functions, or and then Tai Chi is like, it's like taking that into and turning these individual words into a poem or something, if you will. So, but it's basically a Chinese form of rehabilitative exercise. It's one way to look at it. And then there's dietary therapy, and then there's manual therapies, meaning things like massage, but also some techniques which, back when I went to school, starting some 25 years ago, were not very well known in this country. Have become much more widespread. Suction cupping, which Olympic athletes now use. It got a big boost in popularity in this country after the 2008 Olympics, when the U.S. swim team came out and they all had these suction cup marks all over their back that looked like they'd been attacked by a squid or an octopus. And so suddenly all the acupuncture clinics are getting all these phone calls from people saying, wow, do you do suction cupping? I really want to try that and stuff. I'm like, well, they've been doing it in China for thousands of years, but it's very effective for muscle tension and muscle strains and some other things too. So yeah, manual therapies, dietary therapy, herbology, acupuncture, and the exercise therapy. That's kind of the 5 branches of classical Chinese holistic medicine. There was also a fair amount of Western medicine involved in the training program too. We had to learn about pharmacology and pathophysiology and diseases and Western clinical medicine to be able to, because our patients are getting Western care typically as well, and we have to be able to understand what their treatments are and their diagnoses are and interface with the Western medical system in order to function effectively. So,
yeah. And so there's this Western approach, and then there's the Eastern approach. What do you think are some of the more major differences in the two approaches to medicine?
That's a good question and a big one. There is more overlap than I think is often explained to the public or seen by the professions. The longer I practice, the less difference I see between some of the basic theories. I mean, the understandings of how the human body works in health and disease, the language used to describe them is quite different in Chinese than it is in Western medicine. But the basic understanding is but to put it in simplest terms, movement is life and stagnation is death. But how that plays out in terms of diagnosis and treatment is very different. Western medicine has generally an orientation towards finding a single disease-causing mechanism or pathogen or injury, and then often using fairly radical methods to, surgical, to remove it from the body and replace it with something else, or go in, fix it up, sew it back together, and screw it back together, or using drugs that tend to have very powerful, but often also have a lot of side effects and risks associated with them. And the Chinese medicine approach is more looking at function and a little less at structure. The emphasis is more on sort of promoting the body's own self-healing mechanisms to address functional problems and restore functioning through stimulating the body's own self-repair processes. So they are quite different in that respect. And Western medicine has actually come closer to Chinese medicine, I would say, even in the 25 years or so that I've been in training and practice, where there's now greater understanding in Western medicine about the complexity of body systems and how they affect each other. And that there's rarely an isolated single phenomenon that is the explanation for a patient's symptoms. It's often a constellation of overlapping problems. Some of the risks and side effects of Western medicine are well understood now. Actually, interestingly, there was a study a few years ago that found that Western medical professionals have higher rates of using complementary and alternative medicine than lay people do. So there's an understanding within Western medicine of its limitations. And not knocking Western medicine, I probably wouldn't be here. Actually, my mom had some birth complications, and we probably both would have died in childbirth if it weren't for Western medicine. So I always remember that I'm here thanks to Western medicine, and I've benefited from it at various times in my life. And it's great for kind of heroic intervention, car crashes, burns, certain kinds of serious, illnesses and so on. Where Chinese medicine really, I think, has a role to play is kind of chronic and subtler and early stage problems, or complicated problems that don't have a single explanation, and addressing kind of the whole organism. And the two actually complement each other fairly well. And I refer patients to Western doctors, and sometimes they refer back to me, and because there's certain strengths that each medicine has and certain weaknesses that each medicine has, and put them together and you get a more complete approach. So.
Yeah, so it's not a one or the other thing. It's a complementary, combination of both.
Yeah, it doesn't have to be one or the other. I mean, there's some things that's like, If I have a fracture, I'm going to go to urgent care and get it set, get a splint or a cast or whatever. If I have chronic nerve pain in my, leg and back, I'm going to go seek out an acupuncturist and probably try to do everything I can to avoid back surgery. So there's some things where there's just one medicine just works so much better than the other. But then there are other things that really need kind of both. And unfortunately, there's a few conditions or a few patients that don't respond well to either. So medicine it's in some ways the most complex, most difficult art and science of, I want to say, almost any profession. That's why it takes doctors 10 years to get through undergrad, medical degree, residency, 12 years, postdoc fellowship, et cetera. And in Chinese culture, it was basically considered a lifetime's worth of study and practice with no one ever achieving, complete mastery, so that's different than a lot of professions where you kind of reach a place where you're like, yeah, you're, pretty much everything there is to know, and you can make it all work well. I'm simplifying, oversimplifying. I don't mean to put down the complexities in civil engineering or, computer software programming and stuff, but human beings are very unpredictable in how they respond. We're complicated organisms, and we have as a human being myself, I have my own biases that I have to constantly be correcting for. And, we don't see things clearly when we're looking at our fellow humans the way we can when we're looking at a bridge or a road or a computer or something like that. So if that makes any sense.
Yeah, absolutely. Yeah. So once you graduate, what did you do after you were certified and fully educated?
Sure. Yeah, so most states in the U.S. now require a license. You have to pass a licensing exam in order to practice. There's a few states that don't still, but I was in California, which has pretty much the highest standards and most rigorous licensing exam in the country. Soon after I got licensed, I started my own clinical practice. First, very small, just a couple days a week, but I had worked as an aide in a physical therapy clinic while I was in acupuncture school, because I did want to learn from what physical therapists had to offer. And kind of stroke of luck for me is that the physician who was supervising the physical therapy clinic happened to have been born and raised in Taiwan and then emigrated to this country. And his uncle had cured him of asthma when he was a child through acupuncture. And so he heard that from the other PTs, like, oh, Anthony's going to acupuncture school and getting a license. And he approached me and said, hey, here you're getting a license in acupuncture. Let me know when you got your license. I'll start sending you patients. And so that really helped jumpstart my practice. So it just kind of built from there. And I practiced for basically up until the pandemic in Santa Cruz, California. And then for family reasons, my wife and I moved to Virginia, and couple of years ago, we moved here to Charlottesville, Virginia, where we are now, and opened up our clinic about a year and a half ago. She's also an acupuncturist. I specialize in orthopedics. She does more internal medicine and women's health and pediatrics. But we complement each other in our own ways, and we refer patients to each other for areas that we have specialties in. So,
yeah. And so was there any was there any fear or anxiety of having your own practice where you're completely responsible for it and your own patients?
Yeah, that's a great question. I don't think anyone's asked me that question in a long time, but absolutely. Yeah. So when I first started practicing, both is true for my wife too, when we both graduated from acupuncture colleges about over 20 years ago. And back then there was hardly any jobs for acupuncturists. You got your degree, you got your license, you're on your own. And so it was basically, learning to become a businessman as well, set up a professional organization and a clinic with all the logistics and, et cetera, that involved. Learning how to run an effective business and marketing, which I didn't like to do. I still don't like to do. That's, it's my weak areas. I don't really like to try to sell what I'm doing. I just like to do what I'm doing. Some people love marketing. There are marketing gurus and experts within our profession, as there is in every profession, but I'm not one of them. But yeah, so I started my practice in Santa Cruz, where I'd gotten my license and my degree, and was my hometown. And if it hadn't been for the home court advantage, I think I would have found it even more difficult, but it's a very competitive environment, probably one of the most competitive in the country. It's a small town with a large acupuncture school that cranks out, a new class of graduates every year. And it's a very nice town to live in. So a lot of them want to stick around, and there's an acupuncture clinic. Sometimes it seems like every block, one out of every 250 licensees has residents of Santa Cruz City has an acupuncture license. So I had to carve out my own niche. And the first couple of years were pretty rough, pretty anxious. Like, how am I going to pay off my student loans? How am I going to, keep money coming in the door to, pay the rent and so on. But then it started to really gel as I got more and more, physicians referring patients and word of mouth and so on. And luckily for me, I really loved doing it in some sense. If I hadn't loved doing it, if it weren't a passion, I wouldn't have been able to stick it out through the first couple rough years. It's a different path now for recent graduates from acupuncture school. The VA, major hospitals and medical clinics often have an acupuncturist or two on staff. Physicians are much more open to referring patients to acupuncture. Patients themselves are much more likely to seek it out because it's grown in knowledge and popularity, even in the short, 25, 30 years that I've been kind of exploring the field. So recent grads have an easier time, but it's not like medical school where you're pretty much assured of a job once you got your MD and, you got your license. You can find a job, not necessarily anywhere you want to in the country, but you're not gonna, be unemployed. So,
yeah. So what specifically is acupuncture, and what is the end goal of it?
Well, the end goal is not that different than Western medicine. It's basically restoring somebody's function and quality of life and quantity of life. Healing disease and injury and illness, everything from mental to physical. Acupuncture itself, the word means literally just means needle puncture. It means inserting fine needles through the skin and into sometimes very superficially, basically just into the skin, sometimes all the way deep to the bone. Depends on the patient and their condition, also the acupuncturist and their approach to treating that condition. The needles are solid body needles. We don't inject substances or withdraw substances in this country. Now in China, they actually use hypodermic syringes to do acupuncture and inject herbal preparations or withdraw blood or fluid sometimes. But that's not generally part of the training and the scope of practice in the US for acupuncturists. So we insert solid body needles in various locations, anywhere from the scalp and ears and, head and face on down to the fingers and toes. Basically, one way to look at it and understand it is that it is a small noxious stimulus. It's sort of using the hair of the dog that bit you to cure you. So you insert a small needle through the surface of the skin and into muscle or connective tissue like a tendon or a ligament or a joint, and it provokes a bunch of tissue repair responses. The body responds to that needle by releasing its own internal pharmacy of pain inhibiting and anti-inflammatory neurotransmitters and neurohormones and things called cytokines and cellular messengers of various sort that tell the body, oh, we just suffered a little micro injury, a little micro trauma. We got to bulk up. We got to respond to that. We got to react to that, shut down the pain, shut down the inflammation, rebuild tissue. So often we're taking an old stagnant injury that's kind of stalled in its healing process and jumpstarting it, prodding it to get it going again. That's kind of the musculoskeletal work that I do. My wife, Tamara Brown, what she's doing more is increasing blood flow. So she does a lot of fertility enhancement, for example. So a common scenario for couples that are having trouble getting pregnant is that their reproductive organs are not getting enough blood flow. And acupuncture stimulates blood flow, and so by increasing blood flow to the ovaries, for example, women will produce more eggs and more fertile eggs, or for men, higher quality sperm, etc. It can, but it has a very wide variety of effects. My wife also treats like cardiac diseases. Helps normalize heart rhythm. So another way to understand is that basically our body has all these kind of what are called homeostatic reflexes. The body's always attempting to bring back into balance anything that's out of balance. And the needle will stimulate homeostatic reflexes. If something is too hot, it'll cool it down. If it's too cold, it'll heat it up. If it's in excess, it'll drain it. If it's in deficiency, it'll bulk it up. If it's stuck, it'll move it. If it's moving too much, it'll slow it down. Just by introducing instead of hitting a reset button by inserting a needle into the body. But it's not a random, like you put a needle anywhere. You put a needle anywhere, you get some mild benefit, but to really affect, significant injury, illness, or disease, you have to know what you're doing with those needles too, and target them very precisely into specific tissues and locations and pathways in the body. So.
Yeah. So are there any, what are the limits to the things that can be treated with acupuncture? Like you were saying, someone was having asthma treated with acupuncture.
Yeah.
Are there categories or specific patterns to what can be treated with acupuncture?
I'd say the best role for acupuncture is treating, there's a few of them, chronic pain and disability, particularly where this patient's symptoms don't match what we can find on physical exam or imaging studies like X-rays and MRIs, where it's really kind of a functional disorder where the nervous system is continuing to run pain signals even if an old tissue injury is healed. That's a really outstanding role for acupuncture. Anxiety and depression tend to respond, particularly anxiety responds typically very well to acupuncture. Functional digestive disorders, functional disorders of the internal organs, like I mentioned with the ovaries or the digestive organs or the heart or the lungs, those will all respond well to acupuncture. Acupuncture is limited in how much it can affect structure. So like I said, for a fracture, I'm going to urgent care. But for a joint sprain where the structure may be mildly injured, but there's a lot of swelling and inflammation and muscle tension, I'll seek out acupuncture. I'll do it on myself, for example. So there are long published lists of what acupuncture can treat, and traditionally in China it was used to treat pretty much everything. But there's some things where, certain kinds of emergency medical conditions like a stroke, a heart attack, Western medicine really excels at treating those. Acupuncture can help with the rehabilitation afterwards, after the condition stabilized. So.
Yeah. So I think what intrigued me most is that acupuncture can help with anxiety and depression. How exactly does that work?
Right. The short answer is, again, it has that same effect of kind of rebalancing it. Anxiety and depression are often sort of two ends of a spectrum, and where the patient is, where we all are happiest and most comfortable and stable is in the middle, neither oscillating between anxiety or being, depressed and lethargic and apathetic. And so that, so for example, actually ear acupuncture works fairly well for that because the ear is supplied by a nerve called the vagus nerve that that has effects on sleep and pain and mood and internal organ function. It's a very complicated nerve that kind of goes all over the body, up and down the spine. And by stimulating it, by putting needles in the ear, we can treat addictions, for example, help with smoking cessation, but also help with anxiety and depression and insomnia.
Wow. Yeah, I had no idea that existed. I know lots of people, sort of a Western medicine thing is to go straight to some sort of drug or something like that to help with depression and anxiety and other things like that. So I think turning to other things before people start taking drugs is probably a good option to go to first. But that's fascinating. I had no idea.
Yeah. If somebody's acutely suicidal, I'm gonna make sure that they're seeing a psychiatrist. But so I think the best way to look at it is we've got a role to play in the healthcare system. It's not a one size fits all and everyone needs acupuncture or it's the best medicine. But I would also say the same about Western medicine. It can't treat everything very effectively. So part of the journey for us is both as medical professionals, but also as patients, is figuring out who, when, for what at the right time, and which medicine is going to be the best. And if all you have is a hammer, everything looks like a nail. But the best medical practitioners have a lot more than hammers. They have a big complex toolbox with lots of different options to individualize care for the individual presentations of individuals. So.
Yeah. And so if somebody is starting acupuncture, is it something that they're going to have to do continuously to maintain the benefits that they get, or is it something that they can go and get the benefits for it, and at a certain point they won't have to do it anymore?
Yeah, good question, and that's a common question among patients. The goal, of course, is to get it to where you don't need it. Is that possible? Sometimes yes, sometimes no. There's a fairly large body of research that shows that somewhere around a dozen visits of acupuncture, most conditions tend to kind of stabilize at an improved level. Is that 100% of what it was pre-injury or pre-illness? Not necessarily. So part of that question depends upon what are the patient's goals and what does the patient consider an acceptable outcome. But I would say the majority of the time. Now, this is not true when I first started practicing because it's a skill-based modality. It's not just handing somebody pills. You have to know the right pills, even as a doctor, but there's a lot of skill involved. It's a very high skill profession. And I would say now, somewhere between 3/4 of the time and, 80, 90% of the time, after somewhere between 6 and a dozen or 15 visits or so, my patients are generally stabilized at a much improved level that is satisfactory to them. And then they might need to come back, a few times a year for a tune-up if they have a flare-up or whatever, but they're not needing constant ongoing care. But there's always exceptions to that too. There's some patients that have such a severe injury or a severe pain or a severe problem that they do need just kind of maintenance care. That it's not something that they're going to recover from. On the other hand, if we can keep them out of severe pain, keep them off medications, out of the operating room, improve quality of life, ability to function, go to work, perform their family roles, that's a good outcome for them, even if they're still in some pain or still feeling ill or not quite right. Then there's patients and conditions which just don't respond, so there's a spectrum. There's no single answer to that. So it's a very safe medicine. I'll say that. And the rates of injuries, accidents, and side effects are very, very low. Can it treat everything? No, but it's for non-urgent or life-threatening conditions, it's probably a good alternative to start with and see where it takes you. And then depending on where it takes you, you might want to continue with it. So
yeah. Well, I may end up as a patient, so we'll see.
Okay, very good.
Yeah.
All
Well,
right.
thank you so much. I really appreciate you taking the time.
Thank you. It was a pleasure.